One more common thing is snake bite. So normally what they show in movies is just cut open with something, suck it
Yes,
with
yes,
mouth and
true,
spit it outside and
true.
tie uh, just above the snake bite
Yes,
with a tourniquet. So these are all the things shown in movie,
yes,
and also we have studied some of these things.
yes.
So what is the latest protocol on it?
Okay. Sir, what happens when a snake bites you? Okay. What will kill you the fast? A, the poison of the snake. B, sucking and doing all these things. So 3, your fear of dying. Or 4, all of the above, none of the above. So I will tell you which will kill you fast is your fear.
Okay.
Fear kills you faster than the poison, sir.
Okay.
Believe me. Okay. So what we tell people is when something bites you, don't get panicked. Panic kills you faster. Okay. So now a snake bit you on the leg. Okay. The poison there in the leg has to be taken up into the veins and it has to be transported from there to the heart, and then from there from arteries it has to go to all your body. So it is time taking. It's not immediate.
Right.
Okay. So it is time taking. So it takes some time. So don't panic. Don't be in a hurry. Okay, oh, I'll die. Relax. Now, as you said, what are the first aids can be done? First aid. So earlier they used to bite and spit it out because the poison which is entered into the skin, they want to remove it. That is the purpose they were doing it.
Right.
They were using cutting and doing. Then now it has become a different scenario where it became a fashion to do things. It's not that. So don't do that thing. If you are doing that, means you are taking the poison into your body, which is bad. Instead of patient dying, you will die. Understand, sir? So don't do that. Don't put an X mark. Don't put cut things. Don't suck things. Leave it at it. Okay, so that is first part. Second part, you want to tie a tourniquet. So there are two types of tourniquet. So one is a venous tourniquet, one is arterial tourniquet. Okay, so arterial tourniquet is where you tie it at least 5 inches above your site mark. With your hand inside the tourniquet, tie it tight. Understand? Then you remove your hand. That means it is not tight enough to prevent the circulation.
Okay.
So leg will not die.
Okay.
Only the blood circulation will be stopped, but arterial circulation still will be there.
Okay.
So you have to put 1 or 2 of your hands and then tie above it. Then you remove your, so it is tight enough to stop the spread of the poison.
Yeah,
that's called venous tourniquet.
Yeah, it will stop the venous blood
Yes.
returning into the
Heart,
systemic circulation.
systemic circulation, it will stop, it will
Delay.
slow down, yes, slow down the circulation. That is one thing. And once you tie this, every 1 hour or so, you have to release and then tie it back.
Okay. So what is the reason for
Reason being is if you don't do that, your whole venous blood is accumulated in the leg. So it will swell and it will cause cellulitis.
that?
It will cause the infection of the leg and you will lose the leg, believe me.
Okay.
So that is the reason you have to release it for some time and then again tie it back if it is required. That means if it's taking more time to reach to the hospital. Okay, and then again, so when it's in the leg here below the knee, the whole body is at one level and you can put the knee down position.
Okay.
So that again the blood circulation is little
Slowed.
slowed. Yes, it has to come up and travel
against the gravity.
Yes,
It,
yes.
it slows down.
Yes, if it cannot do that, okay, put a splint to the leg like a fracture.
Okay.
Put a splint to the leg and try to immobilize it.
Okay.
Because if you try to move the limb, it increases the blood flow. But if you immobilize, again the blood flow is slowed down.
Yeah.
Blood is slowed down. So once you've taken care of these small things, patient will not die of snake bite. The snake poison will kill you in 2 types, sir. One is neurotoxin, one is hematotoxin. That means neurotoxin is nothing but the snake makes you paralyzed.
Yeah.
It will make you stop. That means your heart is still beating. But you can't move. That is a neurotoxin.
Okay.
Hematotoxin is where it will bite you. You'll start bleeding from the wound. You will bleed until death.
Okay.
If you don't stop it. That is how the snake bites kill you.
Right.
That is how they eat their prey.
Right.
Understand? That is their mechanism to hunt.
Yeah.
Now, we know the mechanism. We know the poison. Just we give anti-snake venom. He'll be all right. So that means we are giving a medicine to stop the poison to act on your body. If it's a neurotoxin, we'll put you on ventilator, we'll give artificial breathing. So once the toxin effect is over, you will be all right. So there are advanced ways and there are many studies, much more experience we have in treating snake bites or any other bite. In fact, the only thing is you need to approach the right place to get the treatment done.